Providing an update right now as far as coronavirus restrictions. Let's listen in.
Well, good afternoon. Since May, I've come before the public, the residents of the city of Indianapolis, every few weeks with largely positive news about our collective work to combat the spread of COVID-19. We earned the opportunity to enjoy that progress by doing our part to make sacrifices in the name of protecting our neighbors. Yesterday, Governor Holcomb reported that the rate of COVID positivity is steadily rising in Indiana. Unfortunately, I must report that the same is true in Marion County. While I will defer to my partner, Dr. Virginia Kane, in a moment to go through specific data, the broader trend speaks for itself.
This meeting is being recorded.
Over the last week, our city's positivity rate has jumped by nearly 50%. Without a response, that trajectory will undo all the hard work we've done, that we've put in over the last 4 months. We cannot let that happen. And if past is prologue, I know we won't let that happen. Indianapolis will indeed rise to this challenge. And the challenge is this. Our latest data clearly shows that transmission is occurring most often indoors, particularly when groups of people gather to socialize. The data also shows that for the first time, positivity rates are skyrocketing among young adults between the ages of 18 and 30, particularly when those individuals have been congregating in gyms, bars, and other indoor venues. Has increased positivity led to increased hospitalization and death? Thankfully, not yet. Can they? Absolutely. If you don't believe that, look at what is happening in places like Florida and Texas to see how wrong you are. Unlike those places, however, we still have an opportunity to stop this rising rate of infection and hopefully preserve many of the aspects of our daily lives that have returned in recent weeks. To do that, though, we are announcing temporary restrictions that will mitigate the resurgence of COVID-19 in the city of Indianapolis. First and foremost, masks are still mandatory, doubly so after the governor's order. Aside from the list of exceptions provided in today's order, masks must be worn, nose and mouth must be covered whenever we are around each other in public, indoors or outdoors. Social gatherings may not exceed 50 individuals. That includes weddings, banquets, club meetings, and any event where we could come together to socialize other than religious services. Indoor religious ceremonies may be held at up to 50% capacity. Outdoor ceremonies may continue without restriction. When it comes to bars and nightclubs that don't serve food, we must ask that they close until at least August 12th. That includes bar seating at restaurants. Restaurants may operate at 50% indoor dining capacity. Outdoor seating remains preferred with social distancing in place. And we will continue to work with state leaders to permit expanded outdoor seating under our Dine Out program. Importantly, we are now mandating that all restaurants must close for in-person dining between midnight and 5 a.m. Personal services like tattoo parlors, nail and hair salons, and spas may operate by appointment only. Gyms and other fitness centers may operate at 25% capacity. While we are not putting in place any travel restrictions at this time, I also want to note that we are strongly recommending that those traveling to states or to nations with heightened rates of infection should self-quarantine for 14 days upon your return. A list of relevant states and nations will be maintained and updated at the Marion County Public Health Department's website. Their website will also contain the full text of this order. I encourage residents to consult the order for specifics. And finally, for those tourism, cultural, entertainment, and sports venues, we are modifying our existing order to allow no more than 25% capacity with continued adoption of CDC social distancing guidelines. If 25% capacity means that you will be hosting an event that exceeds 250 attendees, you will need to obtain advance approval from the Marion County Health Department. And the Marion County Health Department will review your public health risk mitigation plan. Now, I know that many questions remain as to what the current trajectory of the virus may mean for K through 12 education in Marion County. For now, in-person classes must not resume until at least August 5th. But otherwise, school facilities may continue operation under CDC guidance. That being said, Dr. Kane and I plan to meet with our school system leaders in the coming days, and we fully expect to provide a briefing next week with more definitive guidance as to whether and how in-person K through 12 education may resume, given our current rates of infection. A return to these measures isn't what we wanted. But right now, public health is our number one priority. Nothing else can move forward without it. That is why we instituted a mask order nearly a month ago. It's why we've consistently updated our policies to reflect the best available science on a virus that has made clear that it is not going away. But these policies and best practices only work when we all participate. We must do better, especially younger adults in social settings. If you are out in a crowded public space without a mask, do better for your city. If your office is running face-to-face meetings without masks, do better for your city. If you want our bars and our clubs to return, do better for your city. And if you are fortunate enough to be young and healthy, keep in mind that many of your neighbors aren't. Please do better and mask up for their sake. Dr. Kane.
Thank you. Thank you, Mayor Hutsett. Recently, we have seen how COVID-19 cases in other states have increased substantially with hospitalizations and deaths. Fortunately, with the measures we have put in place in Marion County, we have not seen those similar results. But in the past month, after the July the 4th holiday, we have seen a gradual increase, and we need to get ahead of this to prevent any needless hospitalizations and deaths. And I want to applaud Mayor Hotsett for your continued leadership through this pandemic, because by making that mask a mandate requirement, especially for the Marion County community, this was absolutely the most critical step to help us go in the right direction. And we're doing some good things, but it is not enough. So, as I will detail in a few moments, the data we are seeing in Marion County does not paint the same picture that it did several weeks ago. And our number of new COVID-19 cases and emergency room department visits are moving in the wrong direction. The age of infection that we're seeing has also shifted. More and more young people are contracting the virus. And this means that despite the sacrifices many of us have made, there are just too many of us willing to risk the lives of our neighbors for the sake of convenience. I know Indianapolis is better than this, but looking at the data, I have no choice but to take aggressive actions to protect the health of the people I am sworn to protect as the chief medical officer of this county. But before I begin, I want to echo Mayor Hotsett's reminder. The simple thing that each and every one of us can do to protect those we love is to wear a mask and wear it correctly, fully covering the nose and mouth. If we do not, and if we refuse to follow the restrictions put in place to slow the spread of COVID-19, such as our doing social distancing, washing our hands frequently, we will never reach the new normal we all seek. So when we look at our COVID cases in Marion County, and I'm going from at the start of the epidemic, you will see, do I have a pointer? You will see, oh, here we go, that at the height of our cases, we saw May the 6th, we saw as many as over 300 cases in a day, but the 7-day average was a little over 200 cases. And look, as we put that shelter in place recommendations, you will see that our cases substantially declined over a period of time, and our lowest point was at June the 24th. But then just after that July the 4th holiday, we started to see a rapid increase in our number of COVID-19 cases, where we got down to almost 45 cases per day, and now we've shot up more than double to almost 100 cases per day. And so see that sharp increase. If we looked at it based on the stages that we implemented our new recommendations, you will see that we did great. Stage 3, that was one of our most substantial declines. And we even did primarily, as you can see here, where the state of Indiana went to stage 4, we went to stage 4 near the end of June. We still did a fairly decent job, but once we went to stage 4.5, just right after that, we saw a significant increase. When we looked at the number of people who were positive, let me just have to go back. Which way? Which is the back? So when we looked at the number of people who were positive, with the test. You also saw how at the height of this epidemic, of the people we were testing, 48% at the start of the epidemic were positive. For everyone we tested, almost nearly a half of the people we tested were positive near the last week in April. And we dropped all the way down to 4.2% June the 24th. But again, right after the July 4th holiday, we started seeing a significant climb in our positivity. Like the mayor said, it doubled. And we have now had a 7-day average of our positivity rate reaching 10% of all the people that we've tested over a 7-day average. And when we looked at it by the stage again, once we had moved to stage 4.5, where we opened more places, open bars, events at the convention centers and some other locations, you will see that our positivity percentage went up at 10% from July the 4th and higher. Looking at our symptoms for COVID-19 symptoms, again, seeing a substantial increase since the epidemic started, with a significant decline in COVID-19 symptoms. But we started increasing again from right around the July the 4th and July the 1st date, where we're starting to see definitely a gradual increase in our number of ER visits. We look at hospitalizations. And fortunately for us, and we've seen a significant drop in our hospitalizations, we still appear to be flat for hospitalizations. So we have not seen an increase in the hospitalizations. They have been flat for about the last 3 to 4 weeks. And lastly, if you looked at the deaths, we have substantially dropped in our deaths around July, the holidays. But we've also just in the last 2 weeks started to see the deaths creep up as well. Now, the demographics have really changed drastically, so that when we look at this, you can see that at the start of for the last 2 months, where we've looked at the data from March the 30th all the way through April the 26th, you will see that the bulk of our epidemic was in our senior population. Let me move that out the way I can't see my numbers. So it was in our senior population. And then we only had of our 0 to 19-year-olds, only 1% when we first started the epidemic, the end of March and the month of April. But fast forward to this past June the 22nd, for the very last month, we have seen our age group of 0 to 19 go from 1% at the beginning of the epidemic and height of the epidemic, now slowly creeping up to 11%. But the group that we've seen the greatest amount of increase, 44% of our new cases just in the past 30 days has been in the age group 20 to 39 years of age. They're making up 45% of all of our new cases. And that's followed by nearly 30% in the age group 40 to 59. So of our patients that are 60 years and older, they're making less than a fifth of the cases. And so this has a major implications for us when we look at the risk of transmission and what factors are contributing to this. And it's always important for us because as a county, we may have a number of residents who may live in other counties, but they may actually work in Marion County. So just recently, for the past 2 weeks, we've seen an increase of COVID cases in Hamilton County by 64%, Boone 85%. And while we've seen a 70% increase, Hendricks has shown an 83% increase, and Johnson County over 112% in terms of their cases that are surrounding us. And this is a 14-day rolling average. We're also very cognizant of what's happening in states surrounding Indiana. And on their average number of cases per day for the last 14 days, you can see that Indiana went from an average of 433 cases a day 2 weeks ago, and they're now averaging up to 738 cases per day. We see the 70% increase just in the state of Indiana. But Illinois, where they were averaging 762 cases 2 weeks ago on an average daily count, they've now reached 1.1 million cases per day for the past 2 weeks. Ohio is similar. They've gone from 1,000 new cases per day, where they're now up to 1.3 thousand cases per day. And so similar increases in Michigan and Kentucky as well. So I will reiterate, looking at what we're emphasizing is that the steps that were really measures that we need to take place is that we are reducing restaurant in-house capacity by 50%. We are closing those restaurants. We're closing those restaurants. We're shutting them down to capacity in-house of 50%, and we're closing them down at 12 a.m. where they can reopen at 5 a.m. And all bar seating inside the restaurants are closed. Now, we are closing our bars and nightclubs for at least until August the 12th. And one of the reasons behind that decision was since July the 9th, from our last public health order of the mandate that you're required to wear masks and required to do social distancing, except when you're maybe eating or drinking, we have had 249 complaints. And of the notice of citations that we have issued, 75% of those citations have gone to bars and taverns. And so very concerned related to the risk of transmission for that particular group. We've also reduced the capacity for gyms and fitness centers down to a 25% capacity. When we also look at our K to pre-kindergarten, K to 12 schools, we are making, and we'll hope to have our recommendations by sometime next week, but we are delaying any in-person educational classes until August the 15th. If you want to do virtual or e-learning, that can begin now. And we will be requesting school plans for us to review to determine what is the safe environment we can have for our children to return to school, especially in an in-person And we're also looking at the impact of sports, which will also be under review.
Dr. Kane, I believe, can you reiterate the date in which in-person school can begin?
Yes, the in-person school, we're looking at August the 5th. So we're delaying any in-person educational classes until August the 5th.
Wonderful. Thank you, Dr. Kane. We will open it up for questions. As always, if you'll put your name and outlet into the Q&A box, we'll call on you, unmute you, and you'll be able to ask your question of the panelists. Up first is Abdul Hakim Shabazz with Indie Politics.
Thank you. Good afternoon, Dr. Kane. Good afternoon, Mayor. A couple of questions. On the bar question, I was confused because, Mayor, you said that bars that don't serve food can stay open, but Dr. Kane, yours said bars and nightclubs are closed. So I was just trying to make sure which one is that? Is it just bars altogether, or is it bars that don't serve food? And what about private clubs?
So let me just first talk about all bars and all taverns are closed. That are bars and taverns only are closed. If you have if you're in a restaurant setting and you have bars in that restaurant, the bars in the restaurants are closed. Seating is closed.
Russ McQuaid, Fox 59.
And good afternoon. Yesterday, the Indianapolis Motor Speedway announced that it intended to host the 500-mile race at the end of August with probably about 60,000 spectators. Based on the orders and the partial rollback we're seeing today, Mayor and Dr. Kane, do you see that that will be revisited, or is there a possibility that you would recommend that the Indianapolis 500 be held without in-person spectators this summer?
Well, I don't know. Mayor, you may want to speak first.
Well, Russ, we continue to work very closely with the Indianapolis Motor Speedway. We have had the opportunity, both Dr. Kane and Paul Babcock, the director of the Office of Public Health and Safety, have had the opportunity to review their public safety plan. We will continue to monitor the data. And as we get closer to, by the way, I think universally, the public health experts who advise me think that the Indianapolis Motor Speedway has a significantly thoughtful public safety plan. But at the end of the day, Russ, the data is going, and science associated with it is going to drive ultimately the decision making. Now, I don't want to overstep my bounds and talk in Dr. Kane's space, but from our perspective, we could not have a better and more cooperative partner than the Indianapolis Motor Speedway. We know how profoundly important this race is, not only to them, but to our history, and our city. But public health is the top priority, and I'll trust Dr. Kane's judgment. As I said, Paul Babcock is very intimately familiar with and involved in discussions with the Speedway. We'll just see what the data suggests, not only throughout the rest of this month, but into early August. Dr. Kane.
So I'll just add that, I have to appreciate the Speedway and their group for just being very thorough with their plans. And they've been able to address a lot of the issues that we've been concerned about, whether it's contact tracing or any other areas for risk of transmission. So it's really a great plan. And it was refreshing to know that they have decreased the capacity from 50% capacity of participants down to 25% of participants. So we're going to continue to monitor the data very closely. We're working also very closely with the Indiana State Department of Health, Christina Box, and the State Department of Health in this situation. So we will look to see, based on what happens in our community and community spread, what direction we will go as we get closer to the race.
Great. Sam Quinn, IBJ.
Dr. Kane, you mentioned notice of violations for the mask mandate. Can you go over those again and just sort of explain what that means?
So what happens is that when we have a mask mandate, that if you cannot do 6 feet social distance, that you're required to wear a mask in public. And so we have actually had, since July the 9th, we've had about 249 complaints. And at least 141 of those complaints have been directed to restaurants and bars. And then we have other complaints based on those numbers. And so we try to do first, of course, our education. We'll come and just say, hey, we've got this complaint. We a number of occasions we've been able to observe some of these complaints, these establishments where it is clear that the patrons in those facilities are not following that mandate. So we try to educate the establishment, but when we get a second complaint, that's when they're issued a citation. And that citation initially is $50. If we have a third citation, it would normally be $500. But unfortunately for us, because we're now seeing this increase in our cases, and they're coming kind of at a really rapid pace, we have to really get ahead of our cases. And if we don't get ahead of our cases very rapidly, and we have to look at where the risk of transmission is occurring and make recommendations accordingly.
Great. Dylan McCoy, Chalkbeat.
Hi. We've seen school districts across the city come out with widely different plans and then change those plans in recent days. We're hearing from teachers and parents who tell us they don't feel safe going back to school. Should the mayor's office and the county health department be taking on more responsibility and giving schools clearer guidance about whether and how to reopen, such as by offering benchmarks for when reopening is safe?
I'm sorry, that's a great question. Let me just say that we've been trying to meet recently, repeatedly with our school officials, and we've met with superintendents of townships. We've tried to meet with as many of our private schools, our charter schools related to these issues. And as you know, our data is looking fantastic June the 24th and up through July the 1st, but we've now seen this recent change. And we just got the data Monday to really do a great job of analyzing this. So that's why we're trying to meet on a regular basis with the different schools. And let me just say, the schools are kind of complex for some of them, you know, based on the structure of the school, the number of students in a building, the number of students in a classroom. We always have to be cognizant of students from a food insecurity, may need to have education in a setting. Lastly, for sure, looking at the rate of transmission based on the age of the of the students. But Mayor, I'd like for you to just pipe in here if you don't mind.
Yeah, Dylan, just to give you a sense of things, obviously Dr. Kane has been in very close and consistent contact with all of the leadership of our public schools, as well as private schools and mayoral sponsored charter schools. As this announcement makes clear, in-person education has been ordered to be delayed until at least August the 5th. Now, just to put it into context, of the 11 public school corporations in Marion County, 5 had start dates for in-person learning, theoretically, to begin sometime prior to August 5. So Dr. Kane and I met with all the public school superintendents this morning to make them aware of what we were going to be saying about schools this morning. And so all 5 of those school superintendents realized that now whatever in-person in-classroom educational training that they were going to be providing has to be delayed till the 5th. Now, the other 6 have start dates that are after August the 5th. Several of the school corporations are not scheduled because of decisions that they've made. They've not scheduled to begin until August 17. I also believe that parochial schools in Marion County are scheduled to begin on August the 12th and the 13th. So we believe that we will obviously have another week of data to assess before final decisions are made, but the school superintendents want Dr. Kane and I to provide guidance, and we're going to try to begin the process of offering them greater guidance, specifically as early as next week. And that's just a general. Each school corporation has a different start date, and so 5 are being moved back to August the 5th.
And you've been listening to an update on the Marion County restrictions from Mayor Joe Hogsett, as well as Marion County Health Department Director Dr. Virginia Kane. So right now what we know is restaurants capacity indoors limited to 50%. Bars and nightclubs must remain closed. That is until August 12th. Salons and spas are appointment only. Tattoo parlors also appointment only, and gyms will be held at 25% of capacity. And of course, Mayor Hogsett and Dr. Kane reinforced the importance of wearing masks. There is a mandate for those masks that's staying in place, and that can lead to citations. We're going to have all of this on our website, a very detailed list of what these restrictions mean and how we're taking some steps back in order, what they say, to curb the escalating cases of COVID patients right now. And they do say that those predominantly right now, 44% of those are in the age group between 20s to 30s right now. So really important for them, as they're saying, to watch those numbers. But again, that will be all on our website, wishtv.com, and All Indiana starts now.